I had Juvederm placed in the tear trough area and under my eyes. I'm still puffy and bruised a week later. Is this normal? I had Juvederm placed in the tear trough area and under my eyes. I'm still puffy and bruised a week later. Is this normal? It's hard to see in pictures, but it is definitely more noticeable in person.
Thank you for your question. You submitted some photos and you stated in your question that you had Juvederm in the under eye tear trough area a week prior and you have swelling and bruising, and you're asking if this is normal. Well, certainly this is a question that is probably easily answered by the doctor who performed the procedure for you. But I'll share with you a little bit about my perspective, take this opportunity to maybe provide you with some additional information that may be helpful. I'm a board-certified cosmetic surgeon. I am a specialist in oculofacial plastic reconstructive surgery, practicing in Manhattan and Long Island for over 20 years. Cosmetic and reconstructive procedures of the eyelids and the face is something we do every day. And the use of fillers is also something for the tear trough area, is also something we also do very commonly. So it often amuses me, if you will, when patients who have fillers complain of bruising and swelling a week after a procedure. The reason why it's a little bit ironic is that often people don't want to have surgery because they're concerned about the bruising and swelling after surgery, amongst other things. In fact, in our practice, we have patients who we've done lower eyelid surgery, transconjunctival lower eyelid blepharoplasty, often obviously to address the puffy bags under the eyes, which people are looking to treat non-surgically with fillers, and they can come back after a week and have almost no bruising or no bruising at all. So the paradox, and why I use the term amuse, is that people will avoid surgery and get injectables and still have bruising and swelling. Basically, it's important to understand that a procedure where there's a needle involved is by definition invasive. And so it may not carry the term surgery, but it is something where you are getting something done through the skin and under the skin. And which means that automatically you can hit a vessel or a blood or a capillary and you can get bruising. No doctor is immune from that, and it's important to factor that in when you have these injectables. Swelling, it can also be a significant factor because of the trauma of doing the treatment. The material itself, anything in the hyaluronic acid family, will expand a little bit because of a variety of factors, but because by nature the material is hydrophilic, which means it likes water, it pulls water in. And it can be swollen as part of the natural transition period after this injectable is done. Now, for a lot of people, less is more, and we often will do a little bit and see how they do, and then add upon that later on. We see our patients routinely after 2 weeks when we do an injectable treatment. Now, with the photo you submitted, it's difficult for me to ascertain, but it appears that you have puffy under eye bags, which may have become accentuated from the injectable. If you have a significant amount of fat prolapse, it might be worthwhile discussing this with your doctor about the possibility of undergoing a cosmetic procedure to address the fat prolapse. But as far as the bruising and swelling and the term normal is concerned, the answer is yes, it is normal to have bruising and swelling a week after the procedure. This is part of the normal healing process. And so it's very important that you communicate this with your doctor. And if you haven't arranged a follow-up visit, make sure you do that and see your doctor and show the doctor how you look. As a physician, it is important for me to see how my patients respond to the way I do a treatment. A lot of times patients come to us and they state that they had a, quote, bad experience with name any filler. And often they feel that the filler was not good for them. When I explain that it's really a combination of factors. It may be that the filler isn't, it may be too viscous, too thin, whatever it is, but it's also a lot to do with technique and style and artistry and approach to doing this. I always tell my patients that I approach fillers the way I approach surgery. We take our time, we have a real process, and we do it very, very methodically. And it's not like a lot of offices where a doctor will come in, see you for a second, and do a quick injection and run out. I think that the obsessive quest for the ideal result, it requires time when you're doing these things. But that's a separate issue. Again, I think it's very important you speak to your doctor and discuss how you appear, and I am sure your doctor will appreciate the feedback on how you responded, and it will probably help the doctor make note of what your reaction was or response was with this treatment. The more data, the more communication, the better. So I hope that was helpful. I wish you the best of luck, and thank you for your question.